talked to him a year ago, right? And I didn't cross over because I wasn't cross over yet. How do I capitalize? Let me validate my pitch that I'm going to give you real quick. My last year of selling, I don't sell anymore. I run our LOA team. I'm the VP of sales, but I don't actively sell. My last year of selling, I sold 500 policies during AEP. There wasn't a single Medicare plan that I sold. It was actually my lowest app here. I usually did about 600 apps in AEP. I sold nothing but cancer policies and home health care policies. Because all I did was call out my current book of business and just offer it to them. That's all I did the whole time. So I used this pitch doing that. So in other words, I sold 500 home health care / cancer policies during AEP. So it works. Right? What I'm going to tell you works. To get your mind frame in the right space, to try in the right space. The idea of this pitch is that Medicare is changing, so you need to listen to this. That's the idea of this pitch. It's going to take, the pitch takes about 2 minutes. Who wants to role play with me? Who's comfortable role player? Who can be my customer? Who wants to be my customer? My customer, what's your name? Say it out. Teresa. Teresa, we're going to have to look this way though so everybody can hear this. Alright, sound good? Yep. Do y'all probably have to work on the phone or do you work in person? Person? Even easier. Let's go. I love security. This can work either way. Everything I'm going to teach you is both ways. We're doing it either way. All right, cool. Ready? Teresa? Is that right? Teresa. I'm going to call you up and just follow my lead. Okay. Good news is you're not going to talk all. We're going to find that out really quick. Ring, ring. Hey, Teresa. Hey, this is Jackson over at Rock Insurance. How you doing? Great, great. Teresa, I was just looking through some customers here. I came across your profile. I just wanted to check you in and see how everything's going. You doing okay? Good, good. And how's that coverage we got you working? Is it working pretty well? Working good, okay. Premiums are still okay? They're good there? Okay. No problem there? Getting a little expensive? We can take a look at that if we need to. Let me ask you this, is it working the way that we thought it would? Yes. Perfect, right? I expected that answer, but I just always have to ask to make sure it's research. Now, you said it's getting a little expensive. Did it go up a whole bunch this year?
Every year goes up.
Every year. You've been on that, what, 3 years now?
Yes.
Okay, okay. Yeah, and then what's it up to now?
About at 300.
300, and that's okay. Perfect. Yeah, we can definitely take a look at that and pause. At this point now, we're having a med-sup conversation. So I'm going to do it both ways for you. Now it's going to take a little more than 5 minutes, to be honest with you. It's okay. You've got plenty of time for that. It's going to move efficiently. And maybe on my last drink, so I can take a little. All right, so yeah, what we're going to do is we can take a look at that. Certainly unpause. Teresa, certainly going to take a look at that. It's up to $300. Actually, pause. I got one more question about it. We're in Louisiana. I don't work a lot in Louisiana. I'm guessing we're talking about UNS loss. It's kind of the you're doing. So it's a 300 for one person. Cool.
Yeah, I was thinking more than 3 years on it.
Okay. Let's say if someone's okay, 250.
It's not
It's 250. Is that high? Is that in Louisiana? What is that? It's getting higher, so we can typically be 250.
Usually turn like 65, they're about like
well, let's say she's 68. Let's say she's 68.
I think it's fine.
So we get it down to 200? Okay, cool. I just needed to give you some information because I don't know Louisiana as well as I do Mississippi. All right, okay. All right, Teresa, yeah, that definitely has gotten up there. I certainly want to take a look at how we can save some, get some savings there. Now, I do want to talk about something before we talk about savings. We have had a change to Medicare recently. Have you heard of the Inflation Reduction Act? Yeah?
I mean, my customer does not know.
Okay. Remember, Teresa, you're not an agent. I'm the agent.
Yeah, no, I'm actually.
Okay, yeah.
I don't know.
Gotcha. Okay, so you don't know how it affects Medicare. Okay. Well, let me give you a little history here. In 2023, it came in and put a $35 cap on Medicare, like insulin. It really helped diabetics, which was no big deal. That didn't really affect a lot of people, so most people were okay. However, in 2025, it added a $2,000 maximum out of pocket on your drug costs, and that's for every single person. So what that means for you now is you have a $2,000 maximum out of pocket on drugs. In other words, if you have a worst case scenario situation, you're going to spend $2,000 this year on your drugs. And then in 2026, that actually went up to $2,100. So as you can see, Medicare is changing this every single year. So I want to talk about some things about your profile that are concerning me that we need to talk about and address. However, we do need to address that you're paying a lot for Medicare supplement. So while I've been sitting here gabbing away at you, Teresa, I went ahead and I took the liberty to find a rate for you that's going to be lower, and I've got some great news for you. You want some great news?
Yep.
So, one thing that I was going to do for you is I was going to go ahead and quote something called a cancer, heart attack, and stroke plan. Have you heard of CHAS before? No? Okay, yeah, most customers have not heard about that, so that's pretty normal. The reason I want to bring this up is because I just mentioned to you that change that came with Medicare. You have a $2,100 maximum out-of-pocket for the lifestyle. What that means is if you're diagnosed with cancer, God forbid, you're going to pay $2,100 a year out of your pocket for medicines, like cancer-related medicine, right? And I don't want that to happen. So what I've been doing for my customers this year, Teresa, is I've been getting them a lump sum policy that I customize to pay for your out-of-pocket costs of drugs for 4.5 years. Cost. Anybody want to guess why I say 4.5 years?
Here's the close.
Anybody?
4 years worth of
That's the closest answer you're going to get. If I do a $10,000 policy, it's going to cover $2,100 for 4.5 years.
If I give her this,
Right? Now, what we all know as agents is that $10,000 policy, she can do whatever she wants with it. She can go to Disney World if she wants to, but I've now given it purpose by saying I customize this to cover that max out of pocket for 4.5 years. Make sense? I gave it purpose.
So say that word, Kathy.
So what I've done here is I want to protect you for 4.5 years, Teresa, from your max out of pocket. So I'm going to customize this lump sum policy to take care of that maximum out of pocket in the event you're diagnosed with cancer. I wanted to take care of it for 4.5 years, and that's exactly what this means. So I'm giving it purpose. It's not just a random policy. It works with what they have. And then also keep in mind, I brought up the Inflation Reduction Act. Honestly, the Inflation Reduction Act is helping.
Yeah, but it's hurting them, not to interrupt the presentation, but I explained the 2025 piece that looks good. I call it smoke and mirrors because behind the scenes, all the carriers pay more, now they're down to us.
Yeah. I keep it as simple as possible. I don't present it as a good or bad. Honestly, I can say like, Teresa, great news, you only have a $2,100 max out of pocket now. I want to do that. I want to sell a cancer policy. Teresa, you got a $2,100 max out of pocket. And the good news is I have a product that will actually cover that max out of pocket for 4.5 years. Right? So now her mind's like, Medicare changed, I need to listen to Jackson. And then the second thing is, oh, this has got purpose. He's going to work with my current plan. That's what I've done. Right? Unpause. Now we got to go in. Now we got to rewrite our meds up too. But I want to get this on her mind before I rewrite the meds up. Right?
Let me ask you a question on that. Rewrite my medicine. I've just underwriting, right? So.
Sure. That's what we're about to get to.
Okay.
Ready?
Yep.
We're good. All right. So Teresa, we got that. We're going to talk about what that looks like now. I do want to address the other elephant in the room, and that's that your premium's going up a little bit. I don't see if we can do anything. Before I jump into that, how would you describe your health? Would you say it's still pretty good?
Very good.
Very good. Any medicines that you're taking? No medicines? Gotcha. Do you go to the doctor often? Okay, easy. Now we're good. Yeah, we do so. All right. So she going to be on her. I've got great news for you, Teresa. I've got such great news for you. So you are healthy, so that means you qualify for a new Medicare supplement. And at the same time, I want to kill two birds with one stone. And I got some great news for you. I was getting you a quote for your Medicare supplement. That is offering you a heck of a deal. We're going to get you the Medicare supplement that you have currently, same exact coverage, plus we're going to get you that protection against the Inflation Reduction Act, and everything's going to run you $240 a month. So what we're going to do is we're going to save you $10 a month and get you extra coverage that you didn't have. Anytime I can get somebody coverage that they didn't have and I'm saving you a little bit of money, that's a win-win, isn't it?
Where do I sell it? Right.
Boom. So when we cross, like I haven't done rewrites for anybody else, no one else has brought up, we're spending a lot on the med stuff. So when I do the rewrite, now I'm going to capture the savings, right? That's the phrase you want to keep in mind, capture the savings. I'm saving them, like y'all told me I can get the med stuff for how much? Y'all told me what number?
150 to 260.
Y'all told me 200.
Yeah.
That's what y'all told me, 200. I'm not quoting her 200.
Yeah, I look at I round up to
Yeah,
$7.
in my mind, PDP don't count. I ain't factoring PDP at all. That's not what I'm saying. I don't count that. So y'all told me 200 is what I get the meds on. Her meds on right now is 250. I'm not gonna be able to say, hey Teresa, I can get you a meds up for 200. No, what I said is, Teresa, I got great news. I can get you Medicare supplement and non-cancer protection for $240 a month. Sounds like a win-win. And so now I'm getting you the exact same coverage plus an additional cancer benefit for $240 a month. You're getting extra coverage and saving $10 a month. That's a win-win, isn't it? There you go. I captured the savings. I bundled it together, quoted it as a package rather than individual costs. Everybody get that? Does that make sense?